Welcome to week 31 of pregnancy and the fourth week of the third trimester. This is the last week of your 7th month, and I'm wondering, how are your teeth and your gums doing? Did you know that pregnancy can really take a toll on your dental health? And we're going to cover that along with other symptoms that might pop up in the 31st week of pregnancy. We're also going to talk about baby's development and movement this week, and of course, we're going to check in on our expecting crew. We will also look at what's on our think and do list for the 31st week of pregnancy. Welcome to the Birth Toolbox Classroom. I'm Alice, a doula and childbirth educator, going week by week through pregnancy with you. Sounds like it's time for class. What is happening with baby's development this week? At 31 weeks of development, the fetus is about 16.2 inches or 41.1 centimeters, which is about this long. The weight of the fetus is just about 3.3 to 3.8 pounds, which is about the weight of a regular steam iron. Baby's development this week, they're a continuation of what we've been seeing so far in the third trimester. So they're establishing their sleep patterns, they're starting to turn into that head down position, a fat layer is forming beneath their skin, and their reflexes are being exhibited and practiced. The brain and the lungs really continue to grow and mature rapidly in these final weeks of pregnancy. What symptoms and body changes should you expect at 31 weeks pregnant? Did you know that when we are pregnant, we tend to hold on to more water? Now, this leads to swelling of fingers, legs, feet. You might have stopped wearing your rings. I remember when I had to do that in all of my pregnancies. It seemed to come earlier and earlier in pregnancy with each additional child. Now, in addition to holding on to water, that weight of our growing uterus can also lead to more swelling in our legs and feet. We see this pop up this week with one of our expecting mamas. Swelling at the end of the day is really normal. But if you experience a sudden swelling in your face, in your hands, in your feet, along with a headache or vision problems, or just in general not feeling well, make sure you contact your care provider. This could be signs of preeclampsia, which is a very serious condition, and you'll need to see your care provider to check that out. Now, regular swelling that increases gradually throughout the day or after long periods of standing, that's totally normal. And there are a few things that you can do to help improve this swelling. So regular walking can help, also putting your feet up at the end of the day. Let's talk about one of my pregnancy must-haves that often gets overlooked. That's compression socks. So they're not just for marathon runners or those long flights. During pregnancy, they can be total game changers for managing leg fatigue, swelling, and that lovely end of the day, why do my ankles hate me feeling? That's why I am so excited to introduce today's sponsor, VIM&VIGR. VIM&VIGR is a woman-owned company based in Montana that is seriously elevating the impression sock game. Not only are their socks designed with real people in mind, but they offer natural fibers like wool and cotton. They have wide calf and they have toeless options. They have ultra smooth nylon for those sensory sensitive folks and stylish patterns for when you want your socks to match your vibe. Fashion truly meets function, and honestly, I am here for it. But the part that makes me love them even more, they are big supporters of childbirth education. They have shared an exclusive coupon just for you, and I'm going to link it below. Thank you so much to VIM&VIGR for sponsoring this video. And if you're dealing with pregnancy swelling or just want cozy, supportive socks that look as good as they feel, check out VIM&VIGR. In addition to leg and feet swelling in the 31st week of pregnancy, you might also be experiencing backache, pelvic pain, fatigue, frequent urination, and heartburn.
This week, I've been feeling pretty good. I'm definitely feeling the weight of my belly as I've been getting bigger. It's getting harder for me to bend down and get things off the ground, stuff like that, but it's really not affecting me that much day to day. Mainly I just need a lot of pillows at night all around me to be comfortable. One thing I've been trying to focus on this week is, I guess, having a little bit of better dental hygiene, kind of just babying my teeth a little bit, because I've been having a lot of, my gums have been bleeding and my teeth have been real sensitive, and this happened with my last pregnancy too, in my third trimester, and then even more so after the baby was born. And it just kind of it gradually resolved for the most part, just with time. But it also helps to use a sensitive toothpaste I found.
I am 31 weeks pregnant this week, and I'm feeling, definitely getting a little bit more uncomfortable. I've started having some more reflux this last week, especially in the evenings. So just trying to find different positions that I can be in to sort of help manage that. I've been drinking a lot of different herbal teas, which seems to just kind of help things calm down a little bit. It hasn't been too intense, but enough that I'm trying to mitigate it as much as I can because I don't want it to get any worse. But otherwise, yeah, nothing else too changed from previous week. I've been feeling very grateful for the village that I have around me. It's not really a village in the sense that I think a lot of people think of when they, think of that term of it takes a village, and you want to have your village around you when you're in those, pregnancy and early parenting years. Our families are wonderful, but they don't live close to us at all. So it takes quite a bit of planning and coordinating for them to travel out to be with us, or for us to travel to see them. And so our village has really been a lot more so the friends that we've made in the last few years as parents. A few of our friends who, have kind of stayed with us through this transition from prior to our parenting years. And honestly, the support people that, I have hired to be part of my village. I think that's just as valid a representation of people in your village as anything else. And I feel really grateful to have, my physiotherapist and my massage therapist and my therapist and my doula and my OB, and they're all women, they're all mothers, they're, all at different stages of their parenting journeys, and it's really wonderful to kind of have that element that they bring to the community that's supporting me. And I'm grateful that I am in a position that I can have all of these different support people available.
This week, I don't remember if I've mentioned this last week, but this week what has gotten progressively worse is the sharp pelvic pain that I feel on my left. It's really low back, high pelvis. I thought it was sciatica, but I talked to my OB about it, and I think it's too high to be that type of nerve. And it doesn't shoot down my leg, it just shoots right in my pelvis. But it freezes me, I'll be mid-walk or maybe doing an exercise or something, and it just pangs, and it shoots, and it just freezes me, and I'm I have to catch my breath. And so that's new. I never had that with my first son. And I guess it's just the way baby and all my organs are just being pushed on and compressed right now. But it feels not good because it's jarring, and I never know when it's coming. And so I've just been trying to really stretch it out and do pelvic strengthening stuff, but it's hard. So that's what's new.
Week 31 is a great time to start thinking about that hospital bag. So you don't actually have to pack everything away and zip the bag up, but it's a great time to start making a list of your needs and start gathering the things that you want for the bag. I think of packing the bag in sort of two parts. First is going to be all the things that you're going to need to stay at the hospital. Be comfortable for a few days there. Things like pajamas, nursing bras, maybe slippers, robe, things like that. Those are pretty easy, I think. But when it comes to the other part, the tools that you might want to pack for labor, I get asked a lot about recommendations, and I've put together a list for you. So the link to this list is below. You can also find it at birthtoolbox.com/hospital bag. Now, on the do side of the board this week, I'm adding breast pump. So if you haven't purchased a breast pump yet, it's a great time to tackle this task, and it can be a little bit of a task. I recommend starting with your insurance company to see what they're going to cover. Now, there are many local breast pump companies that can help you navigate this and make that decision easier. Talking about your lifestyle when you want to pump and working with your insurance company. If you have a company like that near you, I would absolutely start there first. Two things not to miss before the week ahead. If you love a packing list and you want to get a look at what I recommend that you pack for your birth. I'm going to put a link down below so you can check that out. And make sure you're getting our weekly newsletter. I'm going to drop that link also below, and you can find it at birthtoolbox.com/newsletter. I hope your 31st week of pregnancy was a great one. Don't forget to hit the subscribe button so that you can follow along through the weeks ahead. See you next week.